It is so nice to see all of you in the midst of rain during UNGA Week in New York City. I want to thank you for joining us for our conversation today, the Missing Link for a Sustainable Future, Gender Responsive Climate Policies for Health Equity. I'm Jennifer Cho, I'm the Vice President of Partnerships at Panorama Global, and we are so pleased to be co-convening this event alongside Global Climate and Health Alliance, Global Health Council, and our very gracious host, Population Council. To open our event, it is my deep pleasure to introduce Dr. Lana Hajj, Population Council Department.
Thank you very much, Jennifer. Good afternoon, excellencies, and welcome to the Population Council. I'm very pleased to see all of you. I've only been on the job 3 weeks, so this has been an amazing opportunity to meet as many people as possible. I couldn't have asked for anything better. Speaking of climate crisis, I've come, or climate in general, I've come from one extreme of the climates to another. I used to be based in Cairo, and I see some of my colleagues from WHO, the Eastern Mediterranean Regional Office in Cairo, are joining us, where it's hot and dry. To come to New York like a day like today, it's not cold yet, thankfully, but it's quite humid. I know we're all preparing for a hurricane here, hopefully no major damage in the US, another immediate impact of the climate changes we're all facing. So distinguished colleagues, as Jennifer introduced me, my name is Dr. Lana Hajj. I'm the new president, very new president of the Population Council. And I come from a global health background from WHO, and then before that I was in the US CDC, based in Atlanta for a long time. I'm really, I think, having a very fresh look at all the issues we are addressing at the Population Council, which are very broad. Before I get into the details and tell you more about the council, I'm very honored especially to welcome Ambassador Dr. Agnes Chimbiri, who's the permanent representative of the Republic of Malawi to the United Nations, as one of our panelists. Welcome, dear Ambassador. I'd like to thank all of our panelists, as well as Jennifer, our moderator, and the whole team for putting this together. It's not easy in the middle of UNGA to have such a panel, so we're always very grateful, and we are very happy, of course, as a council to co-host this together with our co-organizers, Panorama Global, the Global Health Council, as well as the Global Climate and Health Alliances. For those of you who may not be very familiar with the Population Council, we're actually a global research organization, a nonprofit organization. Our main slogan, I guess, is Ideas, Evidence, and Impact. We focus on generating innovative ideas and also on doing research to identify solutions to some of the many key issues that are currently addressing population health across the world, including the climate, but many others. And one of our main focus is impact. So we hope that the research we do, the evidence we generate, would lead to impact at the country level. We do have many country offices across the world, mainly in South Asia and in Africa, and various sub-regions of Africa, and we work across the globe wherever there's a need. We focus, of course, on settings with limited resources. We think these are the settings where the needs there are the highest. Through this Population Council, PERC, or as we call it, Population, Environmental Risks, and the Climate Crisis, is a new initiative, relatively one of our new hubs. We are leading efforts to promote a deeper understanding of the linkages between sustainable development or that are critical overall to sustainable development, including population dynamics, people's health and well-being, including sexual reproductive health research, gender equality, as well as climate change. And I think there's no reminder like UNGA every year to tell us how far we are from reaching our SDG targets. We have about 5 years, and we are very much, short of time. I don't think we like to use COVID as an excuse, but we were late before COVID, and then COVID made it worse. So we have a lot to catch up, which is why I think having these discussions and collaborations are really critical to accelerate progress on these very hot topics. I'm really very grateful to join the esteemed colleagues today for this important discussion on gender responsive climate policies for health equity. And where I was coming from WHO, we have lots of debate on gender responsive, but we think that this is an area that is really very critical as the policymakers and leaders across the world are discussing the best approaches and strategies to be resilient for all crises. It's not just climate. I think if we learn one thing from COVID pandemic is we need to be resilient to deal with various crises, whether they're natural crises like we are seeing with climate, floods, many others, heat waves. I mean, I think we don't talk of the major heat wave that went through the world this last year has been devastating. It's not a one-time event, but it has been devastating. And of course, many other emergencies. And how do we even make sure that some of these groups in the vulnerable groups in the populations are not even suffering more from the impact of these crises? That's why the importance of gender responsive approach. This morning we had a meeting for all the reproductive health CEOs of organizations based in the US. And this was one of the hottest topics is what is really the impact of climate change on sexual reproductive health? How is it affecting women and girls more than others even? Of course, we need more data, and that's what we do here at the Council. We're a research organization, but also we know what many of these answers we already know. We are trying to generate even more evidence so that we have strong policies that are evidence-based. We're doing research that we need to move in parallel because these vulnerable population, including girls and women, cannot wait. And they are very directly linked to the impact of climate change. We know that the impact on girls and women will affect all the families. They will definitely not only affect women's health, they will affect children's health. I mean, there's tons of data linking access of women to services with health of children and families, as well as to economic development. I mean, that's a huge aspect that we're not talking about. No country will reach its economic targets or poverty SDG targets or child health or maternal health without really focusing on improving access of women and girls during emergencies, including climate crises, to all the services. So these I think, the global challenges that we are all facing together makes it even more imperative for us to address these issues in a very comprehensive way. I don't want to make this longer for you because I'm sure you are looking forward to the panel discussion, but we're marking 30 years since we had the landmark UN the ICPD meeting, and where we still, even though there was progress, I would always like to be on the optimistic side, but the ICPD agenda still remains unfulfilled for millions of people worldwide, and I think we still have a lot to do, and especially the sexual reproductive health rights, the choices. These are core global goals, I think, in our Population Council mission, but also I know for many of you, and they really they should be considered. I mean, these are health rights in many ways, and they link very much, I think, to also the country's agendas of, since I'm coming from the health environment, of universal health coverage. Access of women and girls to services should be very much part of universal health coverage, and they also link very well to building resilient systems, which is also a goal for everyone. So I hope our distinguished panel, I'm sure the panel represents a really wide group of people and experts who are working very actively on these issues. I'm sure it's going to be a very thought-stimulating discussion, and I hope that our presence here just really emphasizes our commitments overall to the importance of reproductive rights and gender equality. And I really hope that the discussion will not stop after the panel today. I mean, we have a lot of work, and hopefully we can at least reach some consensus on where to go next. That we will need all together to continue moving forward. So thank you again very much, Jennifer. Back over to you, and thank you all for your attendance.
I think we can all be give Rana another round of applause for prioritizing. We have a full room, which is very exciting today, and an even longer list of people who expressed interest. I think UNGA is a time when priorities and events, but priorities overlap. But that's actually one of the exciting things about this opportunity is that we are talking today about intersection and overlapping in priorities. For many years now, Panorama Global has been in conversations with partners about the intersection of climate, health, and equity. We describe ourselves as a platform for social change. Our mission is to advance social impact by empowering change makers through radical collaboration. I like to say that we are really trying to empower and support people in collaboration and catalytic action. And for us in this nexus, what that has looked like is strategic support for activities that are bringing communities together. So we have a small grant making program, and you'll hear from one of our partners today. We are so thrilled to be hosting a community of practice for donors who needed a neutral space to come together to figure out how to navigate forward. And we are doing events like this in collaboration with other organizations to find ways to make more connections. So the title of this panel starts with the missing link, and I think actually Rana pointed this out to us so succinctly. The missing link is not our understanding that climate affects humans. The climate community has been saying that for a long time. The missing link is not an understanding of what it's going to take to be gender responsive and to advance family planning. There are leaders throughout this room who are doing that work every day. And the missing link, as Rana pointed out, is not even understanding that there is data already and even more coming for what this intersection is. For me, the missing link is the opportunity to connect around paths for action, to apply positive pressure in the right places, and to identify and create joint wins, which we think are possible. So we have an incredibly impressive group. I'm very humbled, an impressive group of leaders today who are going to set us up for action. And through their remarks today, they're going to help us understand how to raise awareness, how to highlight the benefits of integrating climate and SRHR agendas. They're going to share critical research, analysis, and proximate leader knowledge. They're going to point to opportunities that leaders are seeing and taking action in, and help us understand what we stand to potentially lose if we don't take action now, and really help us understand what is different about this advocacy moment. And I will say that you could, I'm sure, you would be thrilled to hear from any one of our panelists for the full amount of time that we have. But there's a lot of expertise, and so we're asking people to do these lightning fast conversations so that we can also then pull from the collective genius in this room to talk about ways to take action. So I would like to ask our panelists to come up and take seats. And that will be Dr. Jenny Miller, Executive Director of Global Climate and Health Alliance, Dr. Deepshika Sharma, Director of Climate Sciences at Population Council, Her Excellency Dr. Agnes Mary Tundiri Malande, the Ambassador to the UN from Malawi, Theo Gibbs, Technical Director of Climate at YLabs, Alan Harandia Nunez, Executive Director of the International Youth Alliance for Family Planning. Do we have who? Yes. Oh. Okay, so I also have to, I should apologize in advance for my terrible American accent butchering thing. Lena Freeberg-Nielsen, Chief Technical Advisor in the Ministry of Foreign Affairs for the country of Denmark, And Monica, I'm not gonna do this properly, Tragen, health coordinator, the Ministry of Health Welfare is working together. Okay. Jenny, we're gonna start with you. Let me also say, if anybody would prefer to stand or come over to the podium to make your remarks, just let us know. And we really do need lightning, so Alina will be flagging everyone down. Jenny, patient and persistent advocacy seems to be having an impact. We're hoping you can help us give a point of view from Global Climate and Health Alliance on how we got to this moment where it feels like there is momentum building, and where are the opportunities for health, gender, SRHR, and climate advocates to work together on shared goals in the community.
Yeah, thank you. And need to turn this on. It's on. Okay, thank you. I can't help it. And I should start out by saying I'm not an expert at all in population health or sexual and reproductive health and rights. So I should start by saying I'm not an expert in sexual and reproductive health and rights, and that's part of why I'm so appreciative of this event. What I do know about is the work of the health community working to move policy on climate and health at the intersection of climate and health. The Global Climate and Health Alliance was founded in 2011 on the margins of the UNFCCC process by a handful of health and environment organizations that had been trying to get health on the agenda in the climate conversation and failing, and recognized that in order to do that, they needed to come together, create an alliance, and build a movement. And that's what we've been doing ever since. It has been a slow process. It involved side events and summits on the margins of COP and learning the language of the UNFCCC and things like that, getting a handle on how climate people talk about things so that we could speak their language. It has also required engaging the health community, and that also has been a slow process of helping health organizations and health professionals and health stakeholders understand that climate change is a health issue. In order to keep this brief, I want to just cut to the last handful of years, where I feel like we've seen a dramatic acceleration of the health community's engagement on climate change. And I attribute that to a couple of things. One, the work of organizations, not just the Global Climate and Health Alliance, the WHO has been talking about this intersection for a long time, and a number of organizations around the world. But also, unfortunately, we're seeing the climate impacts really ramp up and have those health impacts. And it's becoming increasingly undeniable to the health community that climate change is impacting their patients, the communities that they're serving, the work that they're trying to do when health clinics and health facilities are wiped out. So that has really accelerated engagement. Side by side with that, the work that ourselves and WHO and many others have done have eventually successfully started to engage the COP, the UNFCCC climate negotiations process. We saw last year, for the first time ever, a health day at the COP. The UAE organized for over a year to really put energy into that health day and make it a meaningful event. And the health community really responded by coming in around that. One of the things that came out of that was the COP28 UAE Declaration on Climate Change and Health that I believe at this point 151 countries have signed on to. That started to really generate some momentum. That was then followed this year by the successful adoption at the World Health Assembly of a new climate change resolution. this was, the seed for that was planted by a number of civil society organizations reaching out to member states and saying, would you consider doing this? We think it's time for a new resolution on climate change that the issue needs to be updated. Countries stepped up, a number of member states stepped up to really lead this process. The Netherlands and Peru spearheaded and shepherded the process through, and we have quite a good resolution. In that resolution, gender was a hard fought topic. And this is where I want to come back around to the importance of our communities collaborating. I didn't know what the difference between gender responsive and gender sensitive meant, but folks in the room advocating for and supporting that resolution process from this community did. And in order to get those kinds of things right, we need to be working together. I think there are going to continue to be important opportunities to elevate the intersection of climate and health. The current COP presidency has already said they want to build in continuity around that into the UNFCCC process. So let's continue to be in dialogue so that the climate and health work gets the sexual and reproductive piece and the gender piece right.
Actually segues nicely into our next speaker, who is the co-chair of the Population Council's Population Environmental Risks and Climate Crisis Initiative. Tushka, what is the research showing you? We know research is critical, that can help us make the case for work in the intersection.
Thanks for that particular aspect of the research. And I think it's what you rightly mentioned. It's also important to now highlight the role of IPCC in the whole process. I personally think it is very important that the research which is out there is now, it should be published actively, especially also on the climate change and health intersection into the IPCC as well. Because currently the focus, mainly has been on the physical science aspects. And we see phenomenal like research which is happening, which has happened over the years along with my colleagues at council. So I would just like to give some examples there. One of the examples we have is on the climate change and SRHR disruptions. And specifically when you talk about, in terms of disasters research across multiple countries, what we see is that there is definitely an interruption on the healthcare services. And the amount in the quantum, if we go to for example, the recent Pakistan flooding, I have the data set here, and the research which I'm presenting right now is for the last almost 5 years, 6 years, is that in this particular aspect of Pakistan flooding, we see, especially we were following the 2010 floods as well. And it was revealed that including SRHR services in the disaster relief led to at least 40% more pregnant women seeking care. And also in 4 out of the 5 studied regions, the contraceptives used increased by over 50%, with benefits extending beyond the recovery period. So it definitely proves that if the access is there, it can be taken up. There is an uptake, there is a need. And another example, I will not go into a lot of details. I have a lot of data set, and I'm sure we can share the links to you. But one of the critical aspects which we are doing right now is on the climate-induced migration settings with a lens of just energy transition. Now, this whole idea of just energy transition, where the countries are gearing up on net zero commitments, how it is integrated, how it is impacting the migration, and then how it is impacting the women and the vulnerable population. So the idea is to capture, basically it's more of an exploratory study at the moment, what we are doing. And we are trying to achieve, and we are trying to see and zoom into the patterns, what are the migration corridors. Specifically right now, we are focusing on South Asia in that aspect. Now, another and when you talked about gender responsive and gender reactive and then gender sensitive, now these are like various terms and which are being, and it's good that we are discussing all these things right now at the moment. Another project which we are working on the program in South Asia is on Bhutan, where we are looking at on women entrepreneurs and specifically in the, how the renewable energy intervention or integration into the water funds helps the women entrepreneurs increasing the productivity, increasing their livelihoods, impacting the livelihoods, the economy, how they are empowering, how the transition to the smart technologies is empowering them into the decision making into the society. So it's a lot of mix, I would say, in that particular aspect. These are very small interventions which lead to, women empowerment in terms of from the technology perspective. Because currently, if you see, the technologies are they are not gender sensitive, I would say. They are more considered that how, for especially in the renewable energy space, if you see, it's like all about how men can use it, who are the main users. But when we went to these women farmers groups in Bhutan, and I was intrigued, like, the way they were saying, we need smart technologies. We need technologies which actually we can use and we can deploy, which help us increasing our incomes. And they are willing to do that. So yeah, that is one of the things. And another I would like to mention on our qualitative aspects, which we have studied in Zambia. The study showed that the extended drought increased, definitely food insecurities. And this is also a very important area to be looked into when we talk about the whole climate change phenomena and the disaster related as well. So yeah, and I can definitely go more if you want. We can talk after the panel as well. Just wanted to highlight that currently we are focusing on, and you might see some QR codes around you. So we are focusing on, rolling out request for proposal for case studies, where we are looking at inviting from the communities, specifically CSOs, and it's a global, kind of RFP which we are rolling out on the climate change and its intersections with the health and SRHR specifically across. And we would like to see that what kind of, there are cases which are existing on the ground, whether it is in Africa, whether it is in Asia, or even in the global north settings as well. So you're free to roam around and you can scan the QR code for the details and submit an expression of interest as well, which is due in 2 weeks. So thank you.
A lot further into the research and such a wonderful opportunity. So thank you so much. Dr. Agnes, Malawi is known as an exemplar when it comes to achieving progress on family planning and SRH, as well as efforts to prevent adolescent pregnancy. But the climate crisis is a serious threat to the positive trends. You have a high-level view as a development and health professional, as an educator, and as a government leader. What has the Malawian government been doing to learn and strengthen systems against climate threats? Do you have advice for other countries in this work?
Thank you very much, Jen, and congratulations to the CEO, and welcome to New York. If you haven't been here. Excellencies, distinguished delegates, I feel really honored to be invited to share my insights in terms of the topic we are handling today, where we need to gather momentum to address public health and climate change, as well as to digest the intersections of gender issues, health equity, and climate emergency. In fact, allow me to share that my PhD, I did this type of linkage. It was population, gender, and development. And my professor said, you always remember as you are doing your analysis or data collection, you have a 3-tier analysis. I was doing macro, meso, and micro analysis. So linking really what is happening at the policy level and what is happening at the institutional level where you're making the interventions or decisions, and what's happening at the household level, community level, as you mentioned. So it was really very interesting. I'd like to concur with the observation that has been pronounced by our moderator, that Malawi is known as an exemplary country when it comes to achieving great progress on family planning and sexual and reproductive health. I would like to allude this progress also to our first president, who people felt he was against family planning. No, what he did, because he was a medical doctor, he said, let's not dictate to the people. That time I was working on population employment. So he said, educate the people. Let them understand what it is that is happening around them. What are the advantages of, family planning or spacing children or delayed childbearing, and also having fewer children. So we really were into this type of research, thinking of understanding how people were understanding this, and then we made messages. This helped people understand really and adopt the family planning. They were even telling us, where were you? We already have too many that we can't afford. So I would like to share with you all what we've done. And the link, particularly for today, the link is the issue of linking with the climate change. We do recognize fully that the climate crisis that prompts a lot of health-related risks pose a serious threat to these positive trends that we've made. Indeed, climate change poses significant challenges to global health, exacerbating existing vulnerabilities and inequalities, particularly for women and girls and other marginalized communities and populations. Integrating gender and health, especially SRHR, to realize the SDG 3 and 5 into climate policies is essential for addressing these challenges comprehensively, ensuring health equity and building resilient communities. In Malawi, even education systems, including curricula, have integrated sexual and reproductive health issues. I was part of the introduction of sexual and reproductive health in the medical, particularly research and data collection in the medical field, as I was teaching at College of Medicine. And I would teach them, gender issues in the medical field are not really part of it. And that was a very critical intervention that they made. I was the director of Reproductive Health Center for Reproductive Health, but I was teaching the medical students. And they would really learn those linkages, the importance of considering gender issues in the medical field, in the medical processes, in any of the fields that they were doing. And we even introduced the Masters in Public Health. So we were even doing more of the master's research as well as courses to make them really do the linkages that we're making now. I want to believe that this phenomena cut across all the least developed countries, or rather the global south. Right now, Malawi is leading the LDCs as chair for the until next year in the climate change process. So what has Malawi done really? So Malawi government has created the policy enabling environment. So the Malawi Constitution recognizes the fundamental right that there should be equal participation of women and men at all levels of governance and the enjoyment of their rights. And then we had the National Gender Policy in 2015, which reinforces the right as enshrined in the Malawi Constitution. And the policy also recognizes that high quality, equitable education and training is the foundation for individual development and emancipation and attainment of sustainable social and economic development of nations. The policy advocates for alternative sources of energy, women involvement and participation in natural resources and environmental degradation and climate change management. And natural resources and environmental policies such as the Malawi National Strategy for Sustainable Development, the National Environmental Action Plan, and the National Adaptation Program of Action, National Determined Contributions, NDCs, or recognize the importance of gender. And I would like to add that we usually have the national disaster prepared plans, which really integrate issues of sexual and reproductive rights. So when we have a disaster like Cyclone Freddy or Anna, whatever it is, we do with support from UNFPA, go in there with the special package for sexual and reproductive rights, because the girls do not have the sanitable packages, they have left everything, or everything has gone with floods, and also the health side, there are no hospitals, there are no what, so we really make sure that we integrate the packages that are needed for health, the sexual and reproductive health. Also, the district development plans, local development level, we integrate gender issues. With the EU and the UN support, Malawi implemented the Ending Violence Against Women and Girls under Spotlight Initiative. What we did, which I led when I was working with UNDP, was we created an observatory hub at the National Statistics Office, and they connected with the district level database. So they were collecting all the information from the ground, whether health service or even in terms of cases, GBV cases and all that, and then they take them up at the district level with all the sectors, they look at the linkages, and again, it goes to the observatory hub. So that observatory hub would be analyzed to inform the policymakers. So what lessons do we have for other countries? So in order to close the gaps that exist between the intersections of gender justice, health equity, and the climate emergency, the government of Malawi strongly advocates for the following approaches. One, integration of gender in natural resources, environment and climate change management, and disaster risk preparedness and management. This forms a principal source of social well-being and economic development. We also want to believe that mainstreaming gender in natural resources and environmental management has a number of benefits, which include enhanced value and ownership of the natural resources by all gender groups, and sustainable and equitable use of soil, water, forests, and resources. So, moderator, permit me to say something regarding population dynamics. The population growth is a driver of climate change. High population growth exerts pressure on the environment and natural resources, leading to environmental degradation. I therefore want to call upon and urge all actors to appreciate that gender, population dynamics, and HIV and AIDS considerations are important in planning and implementation of climate change management programs and also resilience building. I'm sure you agree with me that particularly vulnerable groups such as women, children, and the elderly, and physically and mentally challenged are particularly affected by adverse impacts of climate change. So the involvement of these vulnerable groups in the design and implementation of climate change management programs is essential. Therefore, incorporation of also demographic dynamics such as population density, urbanization, reproductive health, and family planning in development plans will help Malawi and our brothers and sisters in all other LDCs to deal with the effects of climate change. So you can see really my PhD proved that there is that link from the top to the bottom. I thank you.
Dr. Agus is really showing us the need to have as many tools in our toolkit as possible to advance this work and to think about how they all weave together. And Dr. Agus, we have bookended you with two specialists in data and research. I'd like to turn to our partners at YLab. Theo, we were talking just yesterday about the need for data and landscape analyses complementary to the work the Population Council does to make the case to donors on why this nexus is so crucial. And there's a gap in funding. So produced some really great work today. Can you share a little bit about what are the kinds of talking points and knowledge that we need to be sharing with us.
Yeah, thanks, Jen. Hey everyone, my name is Theo Gibbs. I'm the climate director at Y Labs. And just a little bit about my background. I originally worked and my graduate degree is in climate science and environmental science. And then the past 7 years moved into working in reproductive health. And so really have been working at and thinking about this intersection for quite a while. So Y Labs, if you aren't familiar with us, we are a global design and research organization that's focused on improving health and economic opportunity with and for young people, especially young women. And so when thinking about young people's economic futures and health outcomes, it's kind of a no-brainer that we need to be thinking about climate change as a strategic priority. So first, just looking at the data, right, young people make up the largest demographic population and the fastest growing demographic in the countries that are most impacted by climate change now and in the future. And so we have to be thinking about this just as a matter of practicality. And then second, I think, as has been made by several of the speakers, if we are not going to land on durable, effective, equitable climate adaptation or mitigation solutions if young people, especially young women, are not at the table. And that's because young women and girls are at the front lines of the climate crisis, as we all know. And that means that they have unique insight into both what's happening, whether or not that's showed in the peer-reviewed literature, but also they have unique insight into what adaptation solutions are needed and what's going to work for them at the community level and the household level. Y Labs, just to build on the data point and to add some more data to the conversation, even though women and girls have been sounding the alarm for a really long time, the fact is that to make evidence-informed policies, we also need large-scale data sets that are rigorous. And so Y Labs recently completed an analysis of 16 years of DHS data and meteorological data across 33 countries and representing over 800,000 women, and found that increased exposure to heat anomalies and precipitation anomalies led to a decreased use of modern contraception and also a decreased desire among those women and girls for additional children. So, and when you put those two things together from a voluntary and rights-based perspective, that's a problem, right? If women didn't want to have more babies, that's fine, great, you don't have to have more babies. Or if you wanted to have more, that's great too. But if you don't want to have more children and you don't have access, or you've declined access to modern contraception, then that's an issue that we need to care about it because it's threatening decades of hard-earned progress on SDG 3 and 5. And then what I'll say is maybe, and less obviously, I think the backsliding on women's health outcomes also needs to be a concern, not just for folks in the health and gender space, but also for folks in the climate adaptation world. And that, as Jenny mentioned, is kind of a hard world to bridge. It needs to be an issue for folks in that world, because when women and girls have agency and autonomy over their bodies, including when, how, and if they have children, they're going to be more resilient, and they're going to be able to be the leaders they already are in resilient solutions for themselves and their communities, and implementing national, subnational, and household level adaptation strategies. So I'll give you just a few other takeaways from the research and strategy products that Y Labs has produced in the spirit of action and not just like doom and gloom at the end of UNGA Week and Climate Week. So just this week, we released an analysis of current national adaptation plans and health national adaptation plans for 58 low and middle income countries. This expands on a similar analysis that Women Delivered did in 2020. And for those not familiar with it, the NAP process, the National Adaptation Plan process, was created under the UNFCCC as a way of supporting least developed countries to address the adverse impacts of climate change through a structured process. And the HNAP process, the Health National Adaptation Plan process, was created by WHO to do a similar thing, but specifically looking at the health impacts of climate change. So the value of the NAP process and the HNAP process is that it is this real opportunity to bring together diverse actors at a national level to set the agenda for climate adaptation. So we found in that analysis of 58 countries who have publicly released their NAPs and HNAPs that 0 countries included all dimensions of SRHR in those plans. And in particular, 0 countries mentioned voluntary and rights-based access to contraception as a national adaptation strategy. And so that's a huge gap, for one. And then the second finding, I think that's interesting for this crowd, there were many, but is the most mentioned aspects of SRHR in NAPS and HNAPS currently, even though is maternal health and newborn health, probably not surprising. But interestingly, even then, only 25% of HNAPs mentioned maternal health and newborn health. And most of that 25% was due to women or maternal mothers and newborns being named as a vulnerable group. And there were only 3 of those HNAPs that actually outlined any strategies for acting. So I think there's a growing awareness of the vulnerability, but we actually in these critical planning documents need to move towards actual strategies that are named in these planning documents that are deciding budgets and policy agendas. And the good news, I'll end on the good news here, is that, and I think that this is a huge opportunity, is that since 2020, the last time this type of analysis was done, the integration of SRHR in NAPS and HNAPS has increased. So by 10%, not much, but it has increased. And that's primarily been driven by greater inclusion and recognition of gender-based violence. And which rose from 16% mentioned in HNAPS and NAPS to 41%. And even better, I think the even better good news is that 12 of those NAPS and HNAPS actually have very good action-oriented specific implementation strategies for how to address gender-based violence in terms of how gender-based violence is created through climate change impacts through multiple causal pathways. So I think that is those are really good examples that can serve as inspiration and models for other countries. And I think that that shows that it's possible to get that language and to get different dimensions of gender impacts and SRHR impacts into policy agendas that will drive action and collaboration down the line. So the key point I want to emphasize is that there's a huge gap, but there's also a huge opportunity, I think, to weave climate resilience and SRHR together, and that weaving those things together is not, it actually creates co-benefits and returns for all 3, climate, gender, and health, right? I think often it's either we have to do climate and gender, or we can do climate and health, but we can't do all 3 together, that's too hard. Actually, you get benefits from all 3 if we invest at that intersection. So as Jen mentioned, we just released this week a SRHR Climate Action and Evidence Hub. It's really meant to be a community resource for the sector, for the climate sector, the gender sector, the SRHR and health sector. And so that's, the website is climate-srhr.org. There's also a QR code on these little cards that you find on your seat. And on it, you will find a lot of different resources. You'll find an accessible summary of the latest peer-reviewed evidence about the impacts of climate change on SRHR. You'll find inspiring case studies of integrated climate SRHR interventions. And you'll find that full NAP and HNAP assessment that I mentioned, as well as strategic investment opportunities that we've identified for public and private funders who are wondering how to take action there. So whatever where you're coming from, whether it's research, donor lens, or implementer or policy, there's resources there to help you move to action in an evidence-based way. And yeah, I'll pause it there, and excited for the discussion after this.
Thanks so much. I'm really excited to introduce our next speaker. You've heard multiple panelists so far talk about the importance of hearing from communities. Today we have with us Alan Parandia-Nunez, Executive Director of the International Youth Alliance for Family Planning. Alan, IYAFP receives support for your work with leaders whose voices are so critical in this dialogue. Could you tell us a little bit more about the role of your organization in connecting coalitions of young people to advocate for climate, gender, and reproductive?
Good afternoon, everyone. Thank you so much, Jen, for the question. And I think that question speaks to the core of the work that we do. So IYAFP is a global youth-led organization that has a presence in over 40 countries. It was founded in 2013 at the International Conference on Family Planning And since then, we've been advocating to ensure that every single young person everywhere has access to their sexual and reproductive health, rights, and justice. IYFP has gone through a transformation process. In the past, we used to have a country coordinators program where we called upon young leaders in different countries to establish country chapters. However, we pivoted the model to another one. Now we have youth-led organizations, collectives, and networks that are members of IYFP. It doesn't matter if they are registered or not. What unites us is a shared vision of ensuring that all young people have access to a education. So, connecting young people and connecting youth-led organizations to work together is something that we've been doing for years. And well, that's also when we talk about like SRHR and climate justice. I think connecting the dots for young people is not like too complicated because that's the reality of youth activism. Like 1 week, youth are facilitating a CSC workshop, for example. 2 weeks after, they're joining a climate march, for example, in their communities. So young people care deeply about the different issues, and they're not siloed into, oh, I only work on SRHR, and that's it. I'm not going to think, talk, or do anything about other issues. Young people are very dynamic, and that's something that we've known forever, and that's why we decided, okay, we need to look for ways to ensure that our members, but also other youth-led organizations that are working on climate justice issues, have spaces to discuss, to learn from each other, to show solidarity, and to try to strategize, okay, what can we do together to enhance our advocacy efforts? So we decided to convene some consultations. We called them consultations, but in reality, those were conversations. We invited youth-led organizations that work actively in the SRHR space doing advocacy, but also we invited some youth-led organizations working in the climate space. And we had some very thoughtful conversations about, okay, so what are the needs? What are the challenges that we're facing? What are the opportunities that we have? If we were asked, what are our demands in terms of SRHR and climate justice? And those were 3 consultations that happened in English, Spanish, and French, in different time zones, trying to accommodate as many participants as possible. And out of those consultations, we developed a youth declaration on SRHR climate justice, and that declaration was launched last year during COP. And we didn't want it to stay there, like, okay, we have consultations, we collected some, very powerful insights from young people. We wanted to stay in touch and say like, okay, we built this space, how can we maintain this space and build like a solidarity group, get engaged, but also look actively for ways of collaborating. If like certain number of organizations and are following more closely certain processes at the UN and CCC, for example, how can we integrate SRHR language in the advocacy that you're doing, and vice versa. So that is a process that has started last year, of course. We're still building on the process. We are co-creating that space with our partners, and of course, we're constantly looking for new partners. So in case you partner with a youth organization that works either in climate change, climate justice, SRHR, please let us know. Put them in contact with us, and we would be more than happy to collaborate with them as we build this process. We want to make sure that other organizations as well are trying to learn from what young people are doing, because we're trying to actively collaborate. And I know that there are other experiences through the Climate and Health Alliance, the SRHR and Climate Justice Coalition, that us as young people are also organizing and trying to build some very interesting collaborations amongst ourselves. So we would be more than happy to partner with any organizations, to more than welcoming to other youth-led initiatives as well. And of course, we cannot be more thankful for the support we receive from Panorama Global to make this happen. I think that I will put it there. And in case you have any questions, or you would like to learn more about the youth declaration, I have a copy here. I don't have many copies, but you're more than welcome to look for it in our website as well, because it's there. Thank you.
Thank you. So I'm always so inspired as I go through my doctorate to see the way that governments are leading on this. So our final 2 speakers are representing 2 governments, that are doing some very forward-thinking work. Um, if I mess up your name, you're going to correct it when you come to me. Dana Friedberg Nelson, the Danish government has recently published 2 landscaping reports, one on gender and sexual and reproductive health, and the other on education. I want to give you an opportunity to share any key highlights or calls to action that you want the rest of us to know about as both inspiration and ways to collaborate.
Thank you very much, and thank you very much for the invitation. So my name is Linda Nielsen, and I sit in the Ministry of Foreign Affairs Denmark in our team for equal opportunities. So it covers global health, gender equality, SHR, and education. And I'm really pleased to be part of this very competent panel. It's very impressive, and I'm learning a lot as well. So, as you say, the Danish Debate commissioned a desk study of the evidence of the intersection between climate change and gender equality and SRHR, sort of within the context of sustainable development. And we're able to launch this desk study about a month ago now, together with the one on education. And I think afterwards we can find a way to sort of share the link for it for you all. And the background for doing it was really on the back of a growing realization, which I think this all demonstrates, also sort of politically in our context of these interlinkages between sort of social sectors broadly and climate change, environmental issues, and biodiversity, as well as the evolving sort of global conversation around these issues, and seeing this sort of rapidly growing body of great literature and data on these issues. The intention of the study was to try and consolidate where is the robust evidence and what does it show, where is it weak and where are the gaps, and it was to inform sort of our policy work and our engagement with partners around programming and help us sort of enter those conversations. You know, what are we talking about? And equally to also help break down some of the barriers that I'm also hearing described here, which also exist within our internal systems. Certainly in our case, you know, how can we also use this to maybe sort of break through with some of our sort of climate change focused colleagues to really try and figure out where can we forge the connections. So the study really looked across a very vast amount of great and academic literature covering a number of issues and taking sort of a rights-based lived experience approach and focus. So really covering everything from reproductive health, perinatal health, HIV, DBD, and more. So it's fairly rich. I'm not going to attempt to summarize it, except to say that there is, of course, a lot of robust evidence of the negative impacts of climate change on these areas, both the sort of direct impacts and indirect impacts. So, for instance, the impact of heat, droughts, and floods, food insecurity, degradation of social and health services and protection on an area like maternal and newborn health. And needless to say that the evidence is also robust of this being exacerbated by the existing inequalities leading to even poorer health outcomes. And I think it's also been highlighted here a couple of times that the learning about the impact of heat was actually quite an interesting finding for us. You know, as you know, heat as sort of an extreme weather event, if you will. Like this evidence is really strong. Studies, multiple studies showing the increased risk of preterm and stillbirth among women exposed to extreme heat within the 7 days before giving birth. Looking at GBV, similarly evidence of how GBV increases as a result of climate-related impacts, such as, again, extreme weather events, but also livelihood disruption, stress, scarcity of resources, disastrous displacement, and also, of course, with sort of the added-on effect around sort of child marriages and FGM response to GBV. An interesting finding as well, because we also wanted the study to point at, you know, where are the gaps? And definitely it was a finding that more research is needed to understand in what ways and how people are navigating these impacts and how are they best supported in trying to do that. And this also includes the need for more research on how groups facing multiple and intersecting forms of discrimination and particularly along sort of the axis of the identity related to SRHR and how that's been impacted by climate change. But you were also asking sort of what are the calls to action that we feel that this study helps us to sort of maybe try and hone in on. Certainly a need to continue to push for more and improved collection of disaggregated data on all levels and across sectors. I mean, this is so obvious, but it can't be said enough. As well as pushing for SRHR women's specific need for support to be recognized and costed within climate and health related funding, and really an integral part of program implementation. And we see opportunities to do this through locally determined priorities and interventions. Also through combining climate, health, and livelihood activities. That's also something I'm hearing. You know, we might as well look at these things in an integral way. Certainly also around sort of needing to provide funding to women-led grassroots organizations that support contextualized interventions and can also elevate Southern voices in policymaking fora. And finally, very much back to us as a donor, the importance of long-term, consistent, and flexible funding to networks, coalitions, and advocacy organizations that play these key roles in translating the evidence, the lived experience, and programmatic knowledge into policy action, advocacy messaging, and influencing. So I really encourage you all to find the study and see how it might inform and enrich the work that you do. Thank you.
Speaking of action, Monica, again, in admiration and also hoping to inspire action, the Netherlands has been such strong champions and donors to sexual and reproductive health and rights. Are there lessons and recommendations that you can share with us on how to move this effort forward? And would you like to stand up?
Yeah, well, yeah, I was considering setting up, but I'm fine sitting. Thank you, and thank you all for the invite, the opportunity. Thank you for pronouncing my name so very well as you did. Dutch is a very hard language, so credits to you. My name is Monica Schaag. I'm the Counselor for Health, and as such, a representative of the Ministry of Health, Welfare, and Sports in the Netherlands to the United States and Canada. I am also a nurse by training, and well, many of you probably know you don't untrain a nurse very much. You do, as my husband very well knows, he's sick and tired of me telling coffee is not water, etc., etc. You all know the words. I'm sorry, men, but yes, well, exactly. And as a nurse, I've seen my fair share of disparities, gender disparities, and the effects of climate on health. So considering what we've all have been said to our valued panel members, for which I thank you very much, the significance and the urgency of this global threat, the Netherlands has made climate change and health one of the 3 health priorities within the Dutch Global Health Strategy. So we thereby focus on making healthcare more environmentally sustainable and climate resilient. And second, international action on the nexus between climate, food, and water. The Ministry of Health is working together very closely with the Ministry of Foreign Affairs to take action on this field. And one of the concrete ways in which the Netherlands has been seeking to promote international action on climate change and health is through the proposal of the WHO resolution on climate change and health, which you already were so kind enough to mention. Well, as already mentioned as well, the resolution has been adopted at the World Health Assembly in May 2024 of this year. And despite the tough negotiations and political tensions, the resolution bears important reference to gender. It recognizes that climate change exacerbates existing health and gender inequalities and increases vulnerability, as already mentioned as well. The resolution also underscores the importance of paying particular attention to those disproportionately impacted and those already in vulnerable situations, particularly women and girls, when taking action in the field of climate change and health. As the Netherlands, we strongly support gender-responsive climate policies in line with our Dutch Global Health Strategy and feminist foreign policy, by which we seek to pay special attention to those in vulnerable situations and to sexual and reproductive health and rights. We advocate for this amongst other things by recommending such policies for the new WHO Global Plan of Action on Climate Change and Health. This action plan is one of the deliverables of the resolution and hopefully serves as an important tool to embed attention for gender and SRHR into the climate work of the WHO and its member states. We hope this will facilitate a stronger integrated action and help lead the way for more gender-responsive climate policies that are key to build equitable and resilient communities. The Ministry of Foreign Affairs of the Netherlands is in charge of the development cooperation. The Ministry of Foreign Affairs in charge of development cooperation. That makes more sense. Is also supporting implementation of the national adaptation plans, which include health in low and middle income countries where possible and when considered essential to protect and promote SRHR. In addition, the Ministry of Foreign Affairs seeks to assemble and analyze and share information and evidence on the impact of climate change on health in general and SRHR specifically. The current lack of clear data has also been one of the key problems during the negotiations for the WHO resolution on climate change and health, as the Netherlands and like-minded countries sought to integrate reference to gender-responsive climate policies in the draft text. The lack of clear data made it difficult for the WHO Secretariat to make a clear-cut case, leaving it vulnerable to politicized discussion. So I applaud all the efforts taken towards generating more data, and gathering such data and evidence will hopefully make the case for even stronger action and gender-responsive climate policies that are necessary to build sustainable futures for all. So thank you very much for all your efforts. As a woman, I am very grateful for having so strong communities that advocate for this important topic. And as speaking from a government, I encourage you all, governments are accountable. Keep us accountable. Keep reaching out. Make sure we do our work. Thank you.
So we were quite serious about wanting to encourage action. So I think what I'm going to recommend is that we'll take one question from each side of the room. And then what we'd really love to do is get everybody, I'm sure you've been sitting a lot this week, get everybody up and thinking, and hopefully our panelists can join us in looking at a set of question prompts that we have for all of you. But let's start with, is there a question? And Alina will come to you. So first person with our hand up. Thank you.
Thank you. Geoffrey, I'm coming from a civil society organization working in Uganda, Kenya, and Tanzania. And we do work around education, gender, climate action with the young people in rural East Africa. So I have two questions. One is to Her Excellency the Ambassador from Malawi, looking at the best practices that the country has had and how they're going to be adopted by the other countries in East Africa. Are there those learnings that are taking place? Or then even when it was looking at education, or what the president said, let us educate the people. How was this done? Was it these people were being met at health centers? Was it through schools, communities, churches, religious institutions? We would love to understand that. And the other one is going to the Executive Director for IYPF, and looking at the collaborations and the network that you built of the young people taking all the action. What have been the significant milestones that you feel that you are proud of, and what have been your biggest challenges? Because this is some other challenging topic for young people to take to their communities and they continue doing work. We've seen some governments against family planning methods and all that. So how do the youth work on at that front? Thank you.
We respond immediately. Okay, thank you very much. A very good question. Certainly, we did, as I mentioned, we collected data. So hearing from the people, because they coordinated, hearing what they thought about family planning, and we had to unpack what family planning was. So the spacing, delaying, childbearing, and having the number that you can afford. So that's the type of education that the president said we should inform people. Let the people make informed decisions. What are the benefits of child space? What are the benefits of delaying childbearing for the young girls? Or even delaying sexual debut? What are the benefits of that? And then what are the benefits of having fewer children? And they could see we were connecting population and the land issues, the money, how much money they are making, how much food they have at the household, and can they afford to feed the many babies that they are having, and sending them to school, educating them. It connected everything. And therefore, what we did was that based on the information we collected, we did what we called family life education campaigns. They were really real campaigns. We were making a lot of noise, connecting these cultural groups. We educated them, let them see, make special messages in their different dance groups or dance songs in their cultural um, dances or cultural practices. So even you can say that we noticed for early sexual debut was due to cultural practices like initiation ceremonies of the young girls or boys. And then we integrated, we had to deal with the traditional leaders to say, look, they need to be educated and you need to modify your cultural practices. And they realized indeed they needed to do that. With the HIV/AIDS, we noticed that they had cultural practices that were remarrying a widow to a brother. But then that time with the HIV/AIDS, many were dying of AIDS, and then they marry a brother to then it means that the woman was at risk, or the man, the brother, was at risk. And then so they started considering, understanding the need to change, to modify their cultural practices. The issue of the initiation of girls and the education, the government decided, oh, let's change the time that the initiation ceremonies take place. Because they were doing them any time during the education, so the school, the girls and the boys and girls would drop out of school to go and be initiated. Then the traditional leaders understood that no, let's do it during the holiday time. So the holiday time, government made it a rule that holiday time is the time when every other traditional group or village, when they want to initiate their boys and girls, let them do it during holiday time. And also media, we used the media a lot. We did jingles, special jingles, that were sending messages with a particular target, whether policymakers, the teachers themselves, because we also discovered teachers were abusing the girls. So we really made special messages. We made special programs. I remember there was a program that became very, very familiar. It was called for me, when it means you are yourself what? You need to fight for yourself. So that's what it meant, that nobody will do things for you, but if you want progress, you do it yourselves. So if people liked it a lot, and there was phonies, there were programs that they were being recorded in the villages. So the messages were coming from the people themselves based on their experiences. And finally, we also created what we call radio listening groups. This one has remained In fact, you gave a village or a group of, even it could be a group of women or men who do together certain things like maybe income generating activities and other. You give them a radio, they listen to those messages that we're putting on the radio. So it was very, very powerful. And that really made a change. Thank you.
Thank you, Dr.
Yes.
Thank you so much for the question. I'm going to try to be brief for the sake of time. I think that's a very, very important question, a complicated one as well. So in terms of milestones, I think that the first milestone was a convening the conversations between leader organizations that are strongly focused on SRHR advocacy and others that are strongly focused on climate advocacy. I think having that open conversation when we sat down and said, okay, these are our challenges, these are the things that we share, these are the opportunities that we have to collaborate. I think that was the first milestone we had. The second milestone was actually, working together to develop the new declaration. So this was this is the first exercise that we had where we came together and said, like, okay, these are our demands. This is the shared messaging that we are agreeing on. And of course, this is going to be a living document that we will keep updating as we continue the conversation and the shared learning that we have. One of the challenges, I think, is, capacity strengthening when you are used to, for example, SRHR advocacy, usually around, CPD, CSW, etc. Then navigating the UNFCCC process is a whole different thing. It's a very complex architecture that has been built around the climate negotiations. So, organizations in the SRHR space then need to strengthen their capacities to understand how to navigate the UNFCCC process. So that is a challenge that we have. And of course, I think that a common challenge of both worlds is a backlash. When we talk about within the SRHR community, it's very easy to start a conversation about challenges saying like one, funding, funding as stagnated or decreased. And then two, there is opposition, growing opposition. But in the climate space as well, there is growing opposition. Climate deniers are becoming louder and louder in more and more countries. And also governments, they are updating their NDCs, and instead of being more ambitious, some of them are watering down their commitments. So I think that there are challenges as well in both worlds, and navigating those challenges, we are trying to, one, the SRHR space at least, is removing social stigma around certain issues, which is very important to ensure that representatives of communities also speak about those issues more openly. And second, evidence-based advocacy. I think that has been, especially in the SRHR space, very important to ensure that young people advocate to ensure that there is a budget line in the local communities for youth and incentives, for example. I think that I would put it there. But...
Thank you. People have more questions, and I'm going to use this to my advantage. So we would like to invite folks to step back out into the lobby area where there are refreshments and some questions for you all to think about, ideally together. So you'll see 3 different flip charts out there with these 3 questions that are up on the screens right now. We want to encourage you to do some networking and connection. Think about answers to those questions, and please share those with us as sticky notes. I also use this opportunity to use questions for our panelists to engage in a conversation around one of these topics and share what you're talking about on the flip charts. Again, we're really wanting to orient towards action and get you all up and moving. But before we do that, please join me in thanking our panelists once again. Okay, so think, what can we do collaboratively together, and how can we intertwine